A meaningful opportunity exists to improve both safety and quality of life outcomes for men needing treatment for prostate cancer. Today, we'll be discussing a unique and thoughtful clinical trial that is now actively enrolling patients, the Water IV Prostate Cancer trial, which is assessing the safety and efficacy of Aquablation therapy compared to radical prostatectomy in men with localized prostate cancer. I'm especially excited to not only share my experience as a current investigator for the study, but also having joined us today on the show is co-principal investigator Dr. Inderbir Gill of the University of Southern California. You'll want to stick around as we'll be learning more about who is a candidate to participate in the trial, how the study works, the unique design of the study, and how you can get involved. So stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is a question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Very excited to have joining us today on the podcast Dr. Inderbir Gill. Dr. Gill is the current chairman and distinguished professor of urology of the University of Southern California Department of Urology and founding executive director of the USC Institute of Urology. He is the co-primary investigator of the Water IV Prostate Cancer trial. Today, we will be discussing the Water IV Prostate Cancer trial, which is a unique clinical trial that is now actively enrolling patients. The Water IV Prostate Cancer trial is assessing the safety and efficacy of Aquablation therapy compared to radical prostatectomy in men with localized prostate cancer. I know our listeners are anxious to learn more about this study. Dr. Gill, welcome to the Prostate Health Podcast.
Thank you. It's a pleasure and a privilege talking with you.
Aquablation has been a safe and effective treatment option for patients suffering from lower urinary tract symptoms due to benign prostate enlargement. I've really appreciated having Aquablation in my BPH tool bag, so I was certainly intrigued when I heard it was being looked at as a potential treatment option for prostate cancer. I know our listeners would love to hear more about what is the Water IV Prostate Cancer study, but also some of the background, including how the study came about.
Sure, you're one of the leaders in this, but aquablation for benign prostate enlargement has really gained traction, increasingly becoming our go-to procedure for many men with BPH. And for the past 4 or 5 years, we've been wondering, can we do this for prostate cancer as well? So that is the genesis of this thought, and we've had multiple conversations with the company in this regard over the years as to if we can extend the aqua beam a little more towards the prostate capsule and get rid of the entire prostate from the inside would be novel thing. So that's how it started, and then conversations with the FDA to then come up with a effective comparator arm. And we picked a radical prostatectomy to compare it to, which is the surgical standard currently. And then figuring out what would be an appropriate endpoint, what would be a good study design. It took a bunch of thinking and in discussions and really exciting conversations to be able to land on what we currently feel is a innovative trial design, innovative study in general. And we are delighted that the FDA has looked at it and said, this is something that we would like to see more data on. So that's where we are.
I'm sure we will have many interested listeners wondering if they might be a candidate for the Water IV study. We also have a lot of our physician colleagues tuning in as well who may have a patient they would like to get set up at one of the participating sites. I was going to see if you could enlighten our audience in regards to which patients with prostate cancer might qualify for the study.
We are talking basically organ-confined, low and intermediate risk prostate cancer, which means grade group 1, grade group 2, and the lower intensity aspect of grade group 3. which would be Gleason 7 4 plus 3. So this is for men who are obviously 45 years or older. And a fundamental prerequisite is that they should have already picked radical prostatectomy as the treatment that they want. After having had consultations with their urologist, etc., they should have already made the decision, I want radical prostatectomy. So once that has been done and the patient is within grade group 1 to grade group 3 category, then other things come in. For example, it should be clinical stage T2C or less, PSA should be 20 or less, life expectancy should be greater than 10 years, etc. So all those things, but fundamentally we are saying patient has decided on radical prostatectomy is the first bar to entry. Then the biopsy should be grade group 1, 2, or 3. It should be organ confined such that on the MRI, there should be no evidence of, for example, local extraprostatic extension or seminal vesicle invasion. Obviously, no evidence of metastatic disease. And also, these folks should not have had any prior treatment for prostate cancer, such as focal therapy, such as hormonal chemotherapy, radiation therapy, etc. So it's a pretty broad group of inclusion criteria. And then we individualize everything to make sure that the patient would fit the profile. Another point I should say is the prostate size should be 25 grams or larger.
Well, thanks for going through that thorough review of the inclusion criteria for the study. At our clinical site, we're finding that quite a few patients are checking the boxes for the study, and it's really been a popular option at our practice. Next, I thought it would be great if we could walk our listeners through what a participant can expect from the study. What can they expect in terms of the process going from the initial assessment, randomization, and how that process works, treatment, and follow-up?
Sure. Once the patient has been identified as a reasonable candidate for the trial, then the patient can expect a detailed conversation about the pros and cons. And that would be a candid discussion of the actual procedure of aquablation, which is a water jet. Then the conversation is had with them that this is a prospective randomized comparison, such that once both sides agree, both sides meaning the physician and the patient, it will be randomized by the computer. And the randomization is 3-1, such that the computer, for every 3 men, it will assign to aquablation, it will assign 1 person to radical prostatectomy. Total is about 280 or so men that we are looking to randomize. I must say the recruitment has been beyond our imagination. You are the leader in that, by the way, Dr. Pullman, so thank you for that. Till date, in the United States, never has a prospective randomized trial been done showing a comparison between established standard, which is radical prostatectomy, and a novel technology. It just hasn't been done. And that's because it's just hard to randomize men with prostate cancer to one thing or another, especially the organ confined category. And it just speaks to the innovative trial design that has found favor with men who are looking for treatments for prostate cancer. So they can expect a thorough discussion. And then after that, they'll have to sign the appropriate paperwork. And then the randomization occurs. And then the men in either arm, prostatectomy or aquablation, are followed very closely after the procedure to assess for PSA metrics, to assess for continence and potency outcomes, assess for any adverse events, etc. And it is just to protect the patient. And the final point I'd make, Dr. Pullman, is that the primary endpoint of this trial is not just time to continence and potency, but it is truly a direct measurement of the morbidity. So, true clinical benefit. So, what we are looking at is the average number of months that the patient will have with urinary incontinence and erectile dysfunction in the 10 years after aquablation or prostatectomy. So, this is a direct measurement of true clinical benefit. And the reason we are not talking just the first 6 months, we're talking 10 years, is because if the cancer is inadequately treated and the patient then converts to radical salvage treatment, the morbidities that will accrue from that conversion will also be captured. So that's why it's a 3 month, 6 month, 9 month, up to 10 years. Although we are looking at a morbidity, but we are also tying it to cancer control such that both are captured.
Thanks for going through that. At our practice, when looking at men who may be a candidate for this study, again, this is someone who has already decided that they are going down the robotic prostatectomy pathway. They're either not good candidates for active surveillance or just don't feel comfortable with observation, and they really are not interested in radiation therapy. With entering the study, they really have potential access to a treatment for prostate cancer with Aquablation, which uses a high-pressure robotic-controlled water jet to remove the cancer down to the capsule from the inside of the prostate, a treatment that they really don't have access to outside of the study. They are ultimately comfortable knowing that if they get randomized into robotic prostatectomy arm of the study, that's still fine, as they have already decided that is the pathway they have chosen. But if they get randomized into Aquablation, that's great too, because it very well could be a new standard of care as well when the data ultimately unfolds. And if they're in the Aquablation arm of the study, they really wouldn't be burning any bridges down the road. If needed, they could still undergo surgery, radiation if needed, but this may be all they need. Dr. Gill, I was going to see if you could expand just a little bit in regards to the novelty of the Water IV trial design.
Yes, the novelty here is comparing a radical prostatectomy, an established standard, to a novel treatment, surgical treatment. And our co-primary endpoints is number of months with incontinence or erectile dysfunction within 10 years after prostatectomy. Key secondary endpoints are the cancer control, various parameters of cancer control, such as PSA metrics, biopsy, repeat MRI of the prostate. From the biopsy perspective, we want to see what is the complete cancer destruction rate versus anything less than GG2 and anything that is GG3. So again, all the usual things for cancer progression, also looking for any metastasis, etc. But overall, we can expect some initial data, I would imagine, within 12 months. The readout is going to be at about 6 months or so, but then it'll take some time to analyze the data. But initial abstracts should start appearing about a year into the study.
So for those interested in participating in the study, what would be the next step?
They can connect with the study team at Water IV at Proceps-Biorobotics. They can also check out the webpage water4pca.com and reach out to their urologist, their local urologist, and ask them the question. They can reach out to the company that is sponsoring the trial. Those would be ways in which folks could get into the trial.
And I'll also make sure to include that email address and the link to the webpage in our show notes for today's episode. Dr. Gill, any final thoughts today for our listeners?
I would just say, Dr. Pohlman, that this is really exciting. That's why all of us are involved. The possibility of being able to cure organ-confined, low and intermediate risk prostate cancer without compromising patients' quality of life, erections and incontinence in specific, is hugely exciting. A radical prostatectomy, robotic radical prostatectomy, does do a very good job, yet it takes a while for patients to recover their functional outcomes. And if we could somehow treat the prostate cancer without compromising erections and continence at all, I would think would be a home run. And so that's the exciting part. And the other good thing about aquablation in specific is just it can be redone if needed without really cumulative morbidity, cumulative toxicity. So we feel that my final comment would be that looking forward to the day where organ-confined, low and intermediate risk prostate cancer can be surgically eliminated without compromising patients' continence and erectile status.
We really appreciate you taking time out of your busy schedule today to join us on the podcast. Without a doubt, I know this will certainly be one of our more popular episodes. Thanks again for joining us today as a guest on the show.
Thank you so much for the very kind invitation, and compliments to you for all the pioneering work you're doing.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. That's it for today. We will see you at the next episode.